Hey everybody, welcome back. This video is about photoelectric absorption. In radiography, all things considered, there are four specific things that can happen when a photon enters the body. There's transmission, that's when no interaction takes place, photoelectric absorption, sometimes called photoelectric effect, and then there's two types of scattering. Coherent scattering, sometimes called classical scattering, and Compton scattering, sometimes called incoherent scattering. This lesson is about photoelectric absorption, an important type of photon interaction in the body. Photoelectric absorption is exactly what it sounds like. If you understand the name, you will understand what it is. The process starts when a photon enters an atom in the body, and the X-ray photon is completely absorbed by an inner shell electron. This results in the electron being knocked out of its orbit, which we call ionization. The ejected electron is commonly called a photoelectron because it was created by the photoelectric effect. So to summarize this whole process, just remember, it's a photon in and an electron out. However, since an inner shell electron has been knocked out of orbit, there is one more thing that happens. The inner shell vacancy makes the atom unstable. So an outer shell electron is going to drop into the inner shell to fill that void. This is called the cascade effect, and it creates what we call a characteristic X-ray photon. It's exactly what happens in the X-ray tube, but in this case, it's happening inside the body. This is not a scattered photon. It simply gets absorbed in the surrounding tissues. For more information about characteristic photons, watch the video on characteristic radiation. So what are the effects of photoelectric absorption? With all interactions, we're concerned with three things: the dose to the patient, the dose to bystanders, especially you, the radiographer, and last of all, the effects on the image quality. Photoelectric absorption actually influences two of the three. We'll start by talking about the patient dose. Photoelectric absorption is not good for the patient. Here's why. Photoelectric absorption results in ionization because an electron is knocked out of the orbit. This free electron crashes through the surrounding tissues and damages those tissues and cells. All of this results in an increase in the patient dose. In fact, 100% of the photon energy gets absorbed in the patient's tissues. So what about the radiographer and other bystanders? Photoelectric absorption actually has no effect, and that's because in the process of photoelectric absorption, there is no scatter photon created. As a result, there's no dose added to the radiographer. Last of all, photoelectric absorption actually has a good effect on the image. So why is that? Photoelectric absorption is actually what creates contrast in the radiograph. We wouldn't have a radiograph if it weren't for photoelectric absorption. So here's how contrast is created. Some areas in the body, like the lungs or this area of bowel gas, absorb very little radiation. They don't experience much photoelectric absorption, and so they appear dark. But other areas in the body, like this portion of the pelvis, absorb a lot of radiation, and therefore they appear bright. The differences in darks and brights is contrast, and that's how we can see anything in the image. The amount of photoelectric absorption taking place depends on four things. We'll start by talking about the thickness of the part. Here's two examples. In the upper illustration, we have a very thin part, and in the lower illustration, we have a thicker part. In the part with less thickness, there's less matter in the way, and therefore there's less photoelectric absorption taking place. In the lower illustration, there's more thickness in this part. That just means there's more matter in the way, and as a result of that, there's going to be more photoelectric absorption interactions taking place. Tissue density is very similar to this. Even if the thickness is the same, the density makes a difference. In the upper illustration, we're taking an X-ray through the chest. In the lower illustration, we're taking an X-ray through the abdomen. The chest really isn't very dense. It's mostly full of air. Because there's less density, that means in total there's less matter, and when there's less matter in the way, photons are less likely to interact by absorption. In the lower illustration, we're dealing with a body part that is of about the same thickness, but it's significantly more dense. Because it's more dense, we have more matter in the way, and as a result, we have more photoelectric absorption taking place. Another variable is the atomic number. Some tissues have a really low average atomic number, like the air in the lungs, and this results in a low amount of photoelectric absorption. But as the atomic number increases, the amount of photoelectric absorption also increases. This is actually why we use elements like iodine and barium, because they have a very high atomic number compared to the surrounding tissues. In this image, you can see that this high atomic number barium has resulted in a high level of absorption. One more variable that influences the amount of photoelectric effect taking place is the kVp, or the beam energy. In the upper illustration, we're looking at a beam that has a lower kVp. With lower energy, there's less penetration, and therefore more photons are going to be absorbed in the tissue. But if we increase the kVp in any way at all, at any level, this results in a higher energy X-ray beam. There's going to be more penetration. In other words, more photons just pass through the patient, and therefore we have less photoelectric absorption taking place. Understanding the influence of the X-ray beam energy is really important. In general, understand this rule. When we decrease the kVp, this is going to result in an increase in the amount of photoelectric absorption taking place. Photons just don't have enough energy to penetrate through matter. This is actually a good thing in some situations because it increases the contrast in our image. So decreasing kVp results in more photoelectric absorption and more contrast in the image. In summary, here are the key things that we need to know about photoelectric absorption. Photoelectric absorption occurs when a photon enters the body and interacts with an inner shell electron. When this happens, the photon is fully absorbed, which leads to the creation of a photoelectron because that electron gets kicked out of its orbit in the atom. When that happens, an outer shell electron drops to fill the inner shell, and a characteristic photon is created. Also understand that photoelectric absorption is predominant at lower kVps. As we increase the kVp in any way, this decreases the amount of photoelectric absorption taking place. Also remember that this interaction is bad for the patient because it increases the patient's dose. Fortunately, it has no effect on bystanders and adds no dose to the radiographer, and it has a positive effect on the image because it increases image contrast.